So, balik ta sa atong buhat. So, like, 1 minute, isa ka question, grabe na yan. Hindi po siya pwede dapat ilanat eh. Pag sa'yo dapat kasi dito. Ito kasi kanito cholinergic. Kani, kalimot ko ani. Karon ba rin make sense sa iyaha na ang cholinergic gani kay parasympathetic. So, kung parasympathetic, rest and digest. So, kung rest and digest, mag-induce og saliva. So, kung daghag saliva, sobraan nagsaliva sa crisis, atong buhaton, atong ipastop. So, kailangan tag anticholinergic, which is ang atropine. Wet. It measures to dry up secretions and increased heart rate. So, munang atropine sulfate pang pa-dry. A patient taking lisinopril develops a persistent dry cough. Fuck. This is a common side effect of which class of medication? Dry cough o ACE inhibitors. Basta makakause og dry cough. ACE inhibitors jud na siya. Ang dili makakause kay ARBs. Basta Pril. Akong gibasihan pag-answer kay Pril siya ACE. Pero atong remember na muna siya yung very, very kanang attribute. So, which electrolyte imbalance is a primary concern for a patient taking furosemide elastics, which is, oh no, hypokalemia, kaya sobraan biha o kanang excrete og water. When water goes, sodium follows. When sodium goes, water follows. So, leading to hypokalemia na siya, girl. What a patient is prescribed spironolactone, which is a potassium sparing, which dietary instruction is most appropriate. Increase intake of bananas, potassium sparing gani siya. So, avoid salt substitutes. Kay salt substitutes are often made of potassium chloride. So, stop na itong pagkaon ng potassium, which kaon na kag bananas. Dili pwede. Take the medication at bedtime. Karon ba itong kanusa natin i-take ang spironolactone, pero dili siya bedtime ka, mag-ihi ka. Morning na siya. When administering digoxin, the nurse must hold the medication if the heart is less than 60. So, digoxin makapalower sa mo sa heart rate. So, dangerous kan less than 60. And IV na to na i-administer ang digoxin ha. So, very fast yung effect. Which food item must be avoided by patients taking calcium channel blockers like nifedipine? Food item i-avoid nimo patients nagatake og CCB. Grapefruit juice. Ang say hint ani. Citrus interferes with liver enzymes. So, mainly kasi gitag answer nga citrus juice, pero unsa jud ay reason behind that, because pag interfere siya with liver enzymes that metabolize many drugs. Pero kan jud kayo drugs nga bawal ang grapefruit juice, tapil po to siya sa pregnancy nga drugs, pero isa na po diri ang CCB, calcium channel blockers. So example sa CCB kani ni Philippine. So lang ni i-exa ha. So, a patient has an order for both an albuterol inhaler and a steroid inhaler. So, should they be administered? Albuterol is a selective beta 1, alpha 1, kalimut ko na albuterol ba sana siya, pero nana siya kanang specific na title. And the steroid inhaler should be administered. Ansa may kuan ani? B comes before C. So bronchodilator comes before. Una si bronchodilator, asa si corticosteroid. So bronchodilator jud ni siya si albuterol. So, kung bronchodilator siya, alpha 2 siya. Selective siya, alpha 2. Tama pa. Murag na dyan yung question nga. What is the selective alpha 2 agonist? Diba? So, albuterol ang answer. So, una na to si albuterol. 5 minutes, then steroid yun. Allowing for the steroid to penetrate deeper into the lungs. So, kaniyang isa sa mga things na wala ko na ako nasabda ng steroid to penetrate deeper into the lungs. Ano sa essence sa steroid o sa unang steroid para makatabang siya sa lungs. Next. What is a critical nursing instruction for a patient using inhaled corticosteroids? Critical nursing instruction. So what does steroids do? Corticosteroid, fluticasone, inhaled corticosteroid. Rinse water after use to prevent oral candidiasis stress. Yeah, finals niya na to eh. So Montelukast is indicated for long-term and prevention of asthma. Leukotriene modifiers, C. Montelukast. So leukotriene kay muna siya something with cant. I-inhibit niya si cant, which sa to function ni cant. Or used for chronic management and prevention of inflammation. Basta kalimot na ko ba unsay joy function ni cant. Unsay ginabuhat ni cant. Ana. Di man ay haon niya. But long-term use of systemic corticosteroid prednisone can lead to which condition? Long-term use of systemic corticosteroids. So, unsay pa sa systemic? So, nasa sa system, like, nasa sa organ, ano ba yung pasabot? Can lead to which condition? Cushing syndrome. Di man ani mo nga, ang mga steroids, di maka-increase siya og kaning glucose. So, swollen face and sugar. Which laboratory must be monitored for patient with taking heparin, APTT, which measures the pathway efficiency, intrinsic, I remember heparin, anticoagulants ni sila. So, which is the antidotes for warfarin, vitamin K? So, si heparin, protamine sulfate, si vit K sa warfarin. So, the use of opioid toxicity includes pinpoint pupils, unconsciousness, and triad of opioid toxicity, pinpoint. So, sobraan kag opioid. Magkakause ka og constriction sa imong pupils, unconsciousness, and respiratory depression. Opioids is slowing of breathing. Effect of opioids often requiring ventilation. So, opioids makakause og pinpoint eyes. Then, breathing jud niya is very much affected. Which organ is primary risk for toxicity with acetaminophen, Tylenol overdose? Acetaminophen, liver na siya ma-metabolize. Basta NSAID sa kidney siya ma-metabolize. Again, sa acetaminophen sa liver, kidney ang NSAID. So, nag-ask ko sa ChatGPT unsay difference sa acetaminophen og NSAIDs. So, NSAIDs is for inflammation, pain with inflammation, and acetaminophen is walang inflammation. So, mga siya magtimanan. Base na baliktad ko ha, about ng clarified good future. So, a patient with levothyroxine should be instructed to take the medication only when symptoms appear. Ano man ang levothyroxine? Thyroxine is like T4 hormone, diba? So, in the morning, kaya makakause di siya insomnia. So, kung late ni mo siya iinom, makakause siya insomnia. rate for the day. So start the day with it. Okay, so which insulin can be administered regular? So una ang clear first, then cloudy. Para dili ma-contaminate ang fast-acting vial. So kung yung mga types of vial, pa kung kasabtan, nganong unsa nang regular insulin, kano kanimo siya i-administer. Pero like ang metformin is for diabetes, din na siya type 2. So metformin must be held before a procedure involving contrast to prevent lactic acidosis. So na siya gipiti about acidosis, metabolic acidosis, lactic acidosis. So wala jud ko kasabot unsa na sila. So i-prevent nimo ang metformin before a procedure involving contrast dye. Sa na-discuss jud ni siya nga dili nimo i-take ang metformin before a procedure. So including ang contrast dye ana. So lactic acidosis makakause siya og nephrotoxic. So unsa nang nephro kidney can lead to acute renal failure. Okay, long term of use of PPI like omeprazole increases the risk of osteo and C. diff infection. So PPI, unsa nang PPI? Proton pump inhibitor. Asa na nabilang na siya sa gastro, omeprazole. Nabilang dyan na siya sa gastro, pero I don't know what it is for PPI. So is it for GERD? Is it for like pang kalibanga? No, it's like pang omeprazole, pang lax bulk, pang bulk, something like that. Oh, baho mampod ni.
Oh?
Baho.
Baho.
Kiki.
Baho ka na.
Oh my God.
Galing mo ako malagyan ni ay. No, mulagay mo jud ni na.
Oh, dili oy baho na nadaan pagkakamit na ako.
Mulagay mo jud ni baho ana.
Dili jud mo siya kagwang. And bacteria. Acid suppression affects calcium absorption, bone loss. So lactulose is given to patients with liver disease to lower levels of ammonia. Toxin causes confusion, encephalopathy in liver patients. Samot unsa na encephalopathy. So mag-learn tag med surg karon kuan break by para ano na to siya, like malingaw ta sa third year dili ta magsigig. Craziness. Gusto ko malingaw. Kung malingaw ko, kung na ako'y competence at it. So, a patient with penicillin allergy may also have a cross-sensitivity reaction to aminoglycosides. Oh my gosh. Na-discuss ni siya. So, kalimutan ko ani. Good night, ma! Tawag na si Papa, oy. Pamutang-an niya sa imong face pa. Nag-record mangkod ko, oy.